Over 60, small changes in memory and thinking may not be normal aging. Forgetting familiar names, feeling confused in simple situations, or struggling to focus could be early warning signs your brain is under stress. Many serious brain conditions begin quietly, with symptoms people ignore for years. By the time problems become obvious, damage may already be difficult to reverse. In this video, you'll learn 6 critical brain warning signs that affect memory and thinking after 60. Recognizing them early can help protect your independence, mental clarity, and quality of life. As we age, changes in brain function are common, but serious decline is not a normal part of getting older. After the age of 60, the brain becomes more vulnerable to reduced blood flow, inflammation, and damage to nerve cells. These changes can quietly affect memory, focus, and thinking long before a clear problem is recognized. One of the biggest dangers is how slowly brain-related conditions develop. Early warning signs are often subtle. You may misplace items more often, feel mentally slower, or struggle to concentrate in situations that once felt easy. Because these changes happen gradually, many people assume they are just part of aging. However, the brain depends on a constant supply of oxygen, nutrients, and healthy blood vessels. Conditions such as high blood pressure, diabetes, poor sleep, and chronic stress can all reduce brain efficiency over time. When brain cells do not receive what they need, communication between neurons begins to weaken. Another challenge is that the brain is highly adaptable. Many people unconsciously adjust their routines to hide cognitive changes. They avoid complex tasks, rely more on notes, or limit social interactions. These coping strategies can delay recognition of a real problem. Brain health also affects emotional well-being. Changes in mood, motivation, and behavior are often linked to early cognitive decline. Irritability, anxiety, or withdrawal may be signs the brain is under strain. It's important to understand that early brain warning signs do not automatically mean dementia. In many cases, identifying problems early allows steps to be taken to slow or even improve cognitive function. Lifestyle changes, medical care, and mental stimulation can make a meaningful difference. This video is designed to help people over 60 recognize when changes in memory and thinking deserve attention. It is not meant to cause fear, but awareness. The earlier warning signs are noticed, the more options there are to protect brain health. In the next sections, we'll walk through 6 brain warning signs that affect memory and thinking. Each one may appear mild on its own, but together they can signal that the brain needs care and support. Let's begin with warning sign number 1. Memory loss is one of the most common brain warning signs people over 60 notice first, yet it is often dismissed as normal aging. Forgetting small details occasionally can happen to anyone, but ongoing or worsening memory problems are not a normal part of getting older. You may begin to forget recent conversations, appointments, or events that happened just hours or days ago. You might ask the same question repeatedly or struggle to recall information that was once easy to remember. These changes can be frustrating and sometimes embarrassing, causing people to hide or minimize the problem. A key difference between normal forgetfulness and concerning memory loss is frequency and impact. Normal aging may involve slower recall, but important information usually comes back later. With brain-related memory decline, information may be lost completely or recalled incorrectly. Another warning sign is relying heavily on reminders. You may depend more on notes, calendars, or phone alerts to manage daily tasks. While these tools are helpful, a sudden or increasing dependence on them can signal changes in brain function. People over 60 often adapt to memory changes without realizing it. They avoid complex tasks, let others make decisions, or withdraw from conversations to avoid mistakes. These coping behaviors can delay recognition of a deeper issue. Memory loss can also affect emotional well-being. Feeling forgetful may lead to anxiety, reduced confidence, or irritability. Some people become defensive or frustrated when others point out mistakes. It's important to notice patterns. Ask yourself, do I forget recent events more often than before? Do I struggle to follow conversations or instructions? Do family members notice changes in my memory? Do memory problems interfere with daily activities? If the answer is yes, it may be time to pay closer attention. Memory loss can be influenced by many factors, including poor sleep, stress, medications, vitamin deficiencies, and chronic health conditions. However, persistent memory problems may also signal early cognitive decline. Reduced blood flow to the brain, inflammation, and damage to nerve cells can all affect memory. Conditions like high blood pressure, diabetes, and poor circulation increase the risk of memory-related issues over time. The encouraging news is that early recognition matters. In many cases, addressing underlying causes can slow progression and improve mental clarity. Medical evaluation can help identify reversible factors and guide appropriate treatment. Ignoring memory loss allows problems to progress quietly. Over time, untreated cognitive decline can affect independence, decision-making, and safety. Memory is central to daily life and identity. When memory changes begin to interfere with routine activities, it is the brain's way of signaling that something may be wrong. Recognizing memory loss early gives you the opportunity to take action and protect brain health. Next, we'll discuss warning sign number 2, which involves confusion and difficulty processing information. Another important brain warning sign people over 60 should never ignore. Confusion is a serious brain warning sign that many people over 60 overlook. It may not appear suddenly or dramatically. Instead, it often develops gradually, making it easy to dismiss or explain away. You may feel mentally foggy or have trouble understanding information that once seemed simple. Tasks such as following instructions, managing finances, or keeping track of time may become more difficult. Some people describe feeling overwhelmed by situations they previously handled with ease. Another sign of confusion is losing orientation. You may forget where you are, why you entered a room, or what you were about to do. Getting lost in familiar places or feeling unsure about the day or time can be particularly concerning. People often blame confusion on stress, fatigue, or poor sleep. While these factors can contribute, persistent confusion deserves attention. When confusion appears regularly or worsens over time, it may signal changes in brain function. Confusion can also affect decision-making. You may struggle to make choices, feel unsure about simple decisions, or take much longer to process information. This can lead to frustration and loss of confidence. Family members may notice changes before you do. They may observe that you repeat stories, misunderstand conversations, or seem disconnected during discussions. These observations are important and should not be ignored. Ask yourself, do I feel mentally foggy most days? Do I struggle to follow conversations or instructions? Do I feel disoriented in familiar places? Do others notice changes in my thinking? If the answer is yes, confusion may be a warning sign. Confusion can be linked to reduced blood flow to the brain, inflammation, or damage to nerve connections. Conditions such as high blood pressure, diabetes, and chronic stress can all contribute to cognitive changes. Another factor is medication. Many medications commonly used after 60 can affect thinking and alertness. Reviewing medications with a healthcare professional can help identify potential contributors. Ignoring confusion can increase safety risks. Disorientation can lead to accidents, poor judgment, and difficulty managing daily tasks independently. Early evaluation can help identify reversible causes and slow progression. Addressing underlying health issues, improving sleep, and managing stress can support brain function. Confusion is not just a normal part of aging. When thinking feels unclear or disorganized, it is often the brain's way of signaling that something needs attention. Next, we'll move on to warning sign number 3, which involves difficulty focusing and paying attention, another subtle but important indicator of brain health changes after 60. Difficulty focusing is another important brain warning sign people over 60 should never ignore. Many people notice they are more easily distracted or find it harder to concentrate for long periods of time. While occasional lapses in focus can happen to anyone, persistent concentration problems may signal changes in brain health. You may struggle to stay focused while reading, watching television, or following a conversation. Tasks that require attention, such as managing finances, cooking from a recipe, or completing paperwork, may feel more tiring or confusing than before. Another common sign is losing track of what you are doing. You may start a task and forget what you intended to accomplish, or find your mind wandering frequently. This can make daily activities take much longer than usual. People over 60 often blame poor focus on stress or multitasking. While these factors can affect concentration, ongoing difficulty focusing deserves attention, especially when it interferes with everyday life. Reduced attention can also affect memory. When the brain cannot focus properly, it struggles to store new information. This can make memory problems seem worse, even when the issue begins with attention rather than recall. Ask yourself, do I struggle to concentrate on simple tasks? Do I feel mentally tired quickly when focusing? Do I lose track of conversations or instructions? Has my attention span decreased noticeably? If the answer is yes, poor focus may be a warning sign. Difficulty concentrating can be caused by reduced blood flow to the brain, chronic inflammation, poor sleep, or unmanaged health conditions such as high blood pressure and diabetes. These factors limit the brain's ability to maintain alertness and mental stamina. Poor focus can also affect emotional well-being. Feeling unable to concentrate may lead to frustration, irritability, or withdrawal from activities you once enjoyed. Ignoring attention problems can increase the risk of mistakes, accidents, and poor decision-making. Over time, reduced mental engagement can accelerate cognitive decline. The encouraging news is that early action can help. Improving sleep quality, managing health conditions, staying mentally active, and reducing stress can support attention and focus. If you notice persistent difficulty concentrating, don't dismiss it as normal aging. It may be your brain's way of signaling that it needs support. Next, we'll discuss warning sign number 4, which involves problems with language and communication, another key indicator of brain health changes after 60. Language and communication problems are another important brain warning sign people over 60 should never ignore. These changes often appear subtly and are easy to dismiss as nervousness, fatigue, or stress. However, persistent difficulty with speech or understanding language may signal changes in brain function. You may find it harder to find the right words during conversation. Common words may suddenly feel out of reach, causing pauses or frustration. Some people substitute incorrect words or stop mid-sentence because they lose track of what they wanted to say. Another sign is difficulty following conversations, especially in group settings. You may struggle to keep up, misunderstand what others are saying, or feel overwhelmed by fast or complex speech. This can lead to withdrawal from social interactions. People over 60 often joke about having words on the tip of the tongue. While this can happen occasionally, frequent or worsening word-finding problems deserve attention, especially when they interfere with communication. Language changes can also include difficulty understanding written information. Reading instructions, emails, or written notices may take longer or feel more confusing than before. Ask yourself, do I struggle to find the right words more often? Do I pause or lose my train of thought while speaking? Do I have trouble understanding conversations or written text? Do others notice changes in how I communicate? If the answer is yes, language problems may be a warning sign. These changes occur because language relies on complex networks of brain cells. Reduced blood flow, inflammation, or damage to these networks can disrupt communication between brain regions. Language difficulties can also affect confidence and emotional well-being. Feeling unable to express yourself clearly may lead to embarrassment, anxiety, or social isolation. Ignoring communication problems allows underlying issues to progress quietly. Over time, untreated brain changes can make language difficulties more pronounced and harder to manage. Early evaluation can help identify causes such as medication effects, hearing problems, or early cognitive changes. Addressing these factors early can improve communication and quality of life. Language is a key part of independence and connection. When communication becomes consistently difficult, it is the brain's way of signaling that something may be wrong. Next, we'll move on to warning sign number 5, which involves noticeable changes in mood and behavior, often overlooked but closely tied to brain health after 60. Changes in mood or behavior are often overlooked brain warning signs in people over 60. Many assume becoming more irritable, withdrawn, or emotional is just part of aging. However, sudden or ongoing changes in personality can signal that the brain is under stress. You may notice increased irritability, impatience, or frustration over small things. Situations that once felt manageable may now feel overwhelming. Some people become more anxious or fearful without a clear reason. Another common change is loss of interest in activities you once enjoyed. Hobbies, social events, or time with family may feel less appealing. This withdrawal is sometimes mistaken for depression, but it can also be linked to changes in brain function. Mood changes may also include apathy, lack of motivation, or emotional flatness. You may feel disconnected or indifferent, even in situations that previously brought joy or concern. Family members often notice these changes first. They may observe shifts in behavior, increased sensitivity, or uncharacteristic reactions. These observations are important and should not be dismissed. Ask yourself, have my mood or reactions changed noticeably? Do I feel more irritable or anxious than before? Have I lost interest in things I once enjoyed? Do others comment on changes in my behavior? If the answer is yes, mood changes may be a warning sign. The brain regulates emotions through complex networks. When these networks are affected by reduced blood flow, inflammation, or chemical imbalance, emotional control can change. Mood and behavior changes can also affect relationships and quality of life. Increased irritability or withdrawal may lead to misunderstandings, isolation, and stress for both you and loved ones. Ignoring these changes can delay diagnosis and support. Early recognition allows underlying causes, such as medication effects, sleep problems, or cognitive changes to be addressed. Emotional changes are not just personality shifts. When they appear without a clear reason or worsen over time, they may reflect changes in brain health. Next, we'll discuss warning sign number 6, which involves slowed reactions and coordination, an important indicator of brain function that affects safety and independence. Slower reactions and changes in coordination are important brain warning signs people over 60 should never ignore. These changes often appear gradually, making them easy to overlook at first. Many people assume they are simply becoming clumsier or less agile with age. You may notice that it takes longer to respond to situations, such as reacting while driving, avoiding obstacles, or catching yourself when you stumble. Simple movements may feel less smooth or less precise than before. Poor coordination can also show up as difficulty with balance. You may feel unsteady when walking, turning quickly, or standing up from a chair. These changes increase the risk of falls, which can lead to serious injuries in older adults. Slower reaction time occurs when communication between brain cells becomes less efficient. Reduced blood flow, inflammation, or damage to nerve pathways can slow the brain's ability to process information and send signals to the body. Ask yourself, do I react more slowly than I used to? Do I feel less steady on my feet? Have I had more near falls or minor accidents? Do movements feel less coordinated or controlled? If the answer is yes, these changes deserve attention. Coordination and reaction speed are closely linked to safety and independence. Declines in these areas can affect driving, walking, and daily tasks. Ignoring slowed reactions increases the risk of accidents and injury. Early recognition allows steps to be taken to protect brain and physical health. The brain is one of the most vital organs in the body, and changes in memory and thinking should never be ignored. Memory loss, confusion, poor focus, language problems, mood changes, and slowed reactions are all warning signs that brain health may be declining after 60. Each of these signs may seem mild on its own, but together they can signal that the brain is under stress. Early recognition provides the greatest opportunity to slow, decline, and protect independence. If you notice one or more of these warning signs, consider speaking with a healthcare professional. Evaluation can help identify reversible factors and guide next steps. This video is for educational purposes only and does not replace professional medical advice. The goal is awareness, so you can take action before serious problems develop. If this information was helpful, consider sharing it with someone you care about. Early awareness can make a meaningful difference in quality of life. Thank you for watching, and take care of your brain health.